What is half-life in brain tumor PET scans? Imagine trying to take a clear picture of a busy city street at night. The timing of your camera shot matters to get the best image. That's similar to what happens with PET scans for brain tumors. The key factor here is the half-life of the radioactive tracer used in the scan. Half-life is the time it takes for half of the radioactive atoms in the tracer to decay and lose their radioactivity. This decay process is natural and predictable, and it's essential for how PET scans work. In brain tumor imaging, the most common tracer is called fluorodeoxyglucose, or FDG. It's tagged with a radioactive isotope called fluorine-18. Fluorine-18 has a half-life of about 110 minutes, which is roughly 1 hour and 50 minutes. This means that after 110 minutes, only half of the radioactive atoms in the tracer remains as active. As time passes, the activity decreases, which impacts how well the scan can detect abnormal tissue. Understanding the half-life is important for several reasons. First, it influences when the scan should be performed. Since the tracer decays over time, the scan needs to happen while enough radioactivity remains to produce a clear image. If too much time passes, the signal weakens, and the images may become less detailed. Second, knowing the half-life helps doctors determine the right dose to inject. Because the tracer decays quickly, a sufficient amount must be administered to ensure good imaging quality while minimizing radiation exposure to the patient. Another important aspect is the logistics of tracer production. Fluorine-18-based tracers must be made in a cyclotron, a type of particle accelerator, because of their short half-life. They need to be prepared close to the imaging site to ensure the tracer is fresh and still active when used. This short window of activity is why PET centers often have their own nearby production facilities. When a PET scan is performed, the tracer accumulates in areas with high metabolic activity, such as cancer cells in the brain. These cells consume more glucose, which is why FDG is effective for highlighting tumors. The decay rate of the tracer determines how long these signals can be detected effectively. If the tracer decays too much before imaging, it can make the tumor harder to see clearly. In summary, the half-life in brain tumor PET scans refers to the decay time of the radioactive tracer, which is about 110 minutes for fluorine-18. This decay influences the timing of the scan, the dose of tracer used, and ultimately the quality of the images. It's a crucial factor that helps ensure the scan provides accurate information about the presence and activity of brain tumors. Always remember to consult with healthcare professionals for personalized advice and to understand how these details fit into your specific medical situation.